don't need to transcribe. So welcome everybody. Thank you for coming. Just to yeah, make you aware that I will be recording it, but like I say, we will sort of like remove everybody's video images when we put it up on the website. So yeah, if I could ask for you to turn off your microphones just while I'm doing the presentation, just because it can get a little bit distracting. But if you do have any questions, then obviously feel free to ask at the end, because I can't see people's hands up while I'm in the screen that I'm in at the moment. I can hear somebody's microphone that's on, so if you could just turn that off, that'd be great. So just a kind of a brief outline introduction. Hopefully you got the email with a bit of a summary of what what I'm hoping to cover today. So I wanted to think about how we might feel about working with people who self-harm, what we mean by the term self-harm, why might people use that, statistics around self-harm, why we talk, how we talk about it and why that matters, why that's important. Risk from self-harming, self-harming safely, and what can potentially help people. And as with all the other training that I do, we're never really talking about a separate group of people. We're always just talking about people, therefore we're including us in that. So I really want to acknowledge that there is likely to be some lived experience of this subject in people attending today. There's no judgment here. And if this is something that you struggle with, please know that you're not alone and there can be help available. So please do get in touch and I will do my best to kind of direct you. But hopefully you'll find some of these things that we talk about today helpful. Equally, if this is not the right time, I get we're near Christmas, people are stressed, people have got a lot on. If now doesn't feel like right time to do this topic, it will be available on our website in January in the new year. So how we feel about working with self-harm, how do we feel about it? So I know I've been sort of working in this role now for about 10 years, and I know it can bring up a lot of different feelings in people, and it's really understandable. It can make us feel a little bit wobbly. It can bring up lots of mixed feelings, including anxiety. But what's really helpful and what we need to kind of do a little bit of work on ourselves is thinking about where this might be coming from. So are these feelings in relation to struggling to understand why people self-harm? So that kind of, oh, you know, just stop hurting yourself. Is it because you're unsure about how to have a conversation about it because it can feel quite difficult? Or is it because you're unsure how to stop someone from self-harming? And what we will talk about today as we go through is it's not necessarily, the work isn't about stopping people, but it's about supporting them in different ways in which there may be that they are able to stop themselves. And with anything that comes up today, it's not about judging ourselves. If we notice we are having a strong response to things, doesn't mean that we're good or bad. What I just really encourage is that we come from a place of that curiosity, really. So what do we mean by self-harm? So I think what I've found in so many trainings that I've attended in the past that we tend to lump self-harm and suicide together. What I've done is really separate it out today because they're two very different things. And we covered suicide the last time we met. I think it's really important to really define it and think about it as a separate thing. So self-harm is a term used to describe when somebody deliberately hurts themselves, and this can include various different ways in which people might do it. So it might be cutting or scratching. I think when people think of self-harm, cutting tends to be the one that people kind of think about the most. But it can also be burning. So I've known people use very hot temperature showers and things like that and actually end up burning themselves. It might be hitting themselves or banging their head, using something against the body that they would know will cause some form of hurt or harm. It might be inserting objects into the body. Hair pulling is also quite a common one. Bloodletting is also not unusual for some people. And what I mean by that is some people might kind of make cuts and things in order to kind of let blood flow. And high risk behaviors as well, such as getting into fights and not fighting back, which is what I've worked with some men in the past who didn't really kind of think about it as self-harming, but they would instigate kind of arguments, and fights might happen, but then they wouldn't fight back. Their intention was to be harmed. And this is by no means like every way in which people might self-harm, but these are the ones that we might come across the most. So why do people self-harm? So there can be really so many different reasons as to why somebody might use self-harm. And I think one of the key things is actually being curious and asking them what it is that they found helpful about self-harming, and that can then lead us to a better understanding as the purpose it might be serving for somebody. So, drawing on my experience, I've worked with a number of different people who self-harmed. Some of the reasons that they've given me have included because they were really self-loathing and sort of punishing themselves. For some, it was just to change up how they were feeling. For some, it was to just feel something. For others, they've said it was just to know that they were still alive. So if they saw blood, it was a way of indicating to them that they were living and they were still alive. And also for some, it was about relieving a sense of tension or pressure that was being caused. And I guess how I've always approached kind of understanding self-harm is it's just really an indicator that something is going on for that person. So remembering that self-harm is happening for a reason, I think is really key in being able to support somebody, because it can be really hard for that individual to stop. So Janina Fisher, so she's a psychologist who's really specialized in trauma work. So she talks about how people who have experienced trauma and adversity find it difficult to trust others. I think many of us have probably experienced that. And adversity as well, can also have the same impact, and therefore to receive sort of effective support and care from other people can feel really, really difficult. So they find other ways of seeking the relief from how they're feeling. And these share that common characteristic of not requiring a reliance on anyone but themselves. So if you're self-harming, you're not having to rely on anyone else to kind of help you to try and manage what's going on. You can feel completely reliant on yourself. She reports that the most common mistake made by professionals is the assumption that self-harm causes pain rather than it relieves it and alleviates it. So she believes that the core issue in self-harm is the person wanting mastery and relief seeking from the overwhelming kind of distress and tension that they might be experiencing. So it's that kind of means to an end. So I'm experiencing distress and therefore I want to alleviate it in some way. And again, it kind of makes sense that they might turn to that if they find it hard to trust others, or they found other people not being able to offer that support in their past, especially in their early childhood years. And I think what I found really interesting about reading some of her research was that she talks a lot about how people who self-harm often experience from a young age, due to trauma or adversity, high levels of adrenaline. And therefore, that kind of becomes the norm for the body. The body, it's familiar, the body knows that. Therefore, it doesn't feel difficult or scary. And they can learn that adrenaline might actually feel calming because again, it's that thing that they're most kind of exposed to, and they've got that most sense of their body experiencing on a regular basis. So that adrenaline is calming, and also dissociation is also calming, and that pain can increase the production of endorphins, including that sort of analgesic, oh, I can never say that word very well, but that pain-killing effect, that natural painkiller that we have within our bodies, can be created by self-harm. So self-harm becomes a way of trying to soothe. Therefore, self-harm, it can really make sense, as it does not mean on relying on others to alleviate the distress, as when you've been harmed by others in some way, other people can be experienced as dangerous and therefore not helpful or approachable. And validating that they're doing the best they can with what they have available to them, and that you understand that they're doing the best they can to find a way of coping. And I think this is where we need to try not to be judgmental around people who self-harm, because it is generally trying to find a way to alleviate what they're feeling. It's also, I think, really important to just remember that not everyone will have experienced trauma, or they might not recognize that they've experienced trauma. So if you think about, we don't walk around in the world thinking, I've got trauma, or I've experienced adversity or discrimination. We don't kind of label ourselves in those ways and our experience in those ways. So, and I don't think it's for us to kind of label people and tell them that that's the case, that they've had trauma. But what we can do is then maybe gently kind of talk about when they're talking about maybe some of their experiences, or why they're self-harming, we can kind of actually say, actually what we know is that for many people it might be because they've experienced really difficult times in their lives, or had things happen to them that were really difficult, that some people might find traumatic. So it's gently kind of almost bringing that to an awareness, and it's up to them as to whether they want to feel that actually that fits for me. um so I think, really validating that they're likely experiencing painful emotions and distress, I think, can be really key. Using their language and their understanding can be really vital in that, and from what you're hearing from them. So, for example, if they refer to self-harming when stressed, we might then follow up with, what things can lead you to feeling stressed that you feel the need to self-harm? And the general understanding is that self-harm is that need and impulse to manage intense distress and emotions that they're experiencing. So some people might self-harm occasionally due to a particular set of circumstances, or something that's happened or that's come up. Some people, especially people who've experienced early trauma, who have not been supported to learn how to regulate our emotions, self-harm can be used by them as like a regular way of trying to cope. So they might use it far more often. And again, it's like with the suicide session that I did, it's important that we just don't make assumptions about the types of people who self-harm, and stereotype people in terms of genders or age groups. For example, the idea that only young people self-harm, or the idea that you grow out of it. When actually research suggests that if you start self-harming from a young age, that this can and does sometimes carry on into adulthood, especially if they've not found or received support and found other kind of less harmful ways of managing feelings and coping. I think men also, it's kind of seen as maybe more of a female dominant way of coping, but actually I've worked with men who self-harm as well. And it's really important to acknowledge that people who are neurodiverse as well can experience emotions differently, including experiencing feelings more intensely. And due to sort of executive functioning challenges, they might find it much harder to regulate, or struggle with self-monitoring or that impulse control, especially kind of that can often be associated with ADHD. And these all impact that executive functioning. And these are the skills that we also tend to learn throughout life. But it's even more sort of challenging if we've experienced trauma and adversities on top of that. And these functions, I think, is helpful to know, sit in that prefrontal cortex, so that front part of our brain. And it doesn't fully develop until the age of 25. And I think that's really important. And actually, they think it might even be later than 25 as well, that that's still developing, because that's where all those executive functions lie, is in that frontal part, which helps that impulse control and that ability to regulate our emotions. And I also think hormones also can really greatly affect how, again, our brain functions, which might explain why so many young people in particular really struggle, and might choose or might turn to self-harming as a way of coping if you think about all the hormones and all the changes that are happening in young people. But also in terms of perimenopause and menopause as well in women. So it can have a huge effect and might increase somebody's tendency to maybe turn to self-harm as a way of coping. And I think it's really important to think about neurodiversity as well and self-harm, because it also isn't necessarily about, again, I said this in the last training, it's not necessarily about the fact that all new people with neurodiversity will struggle with this, but also it's about how they're supported and how they're responded to in society that can maybe increase then challenges and difficulties around emotions. But it's believed that around 50% of people with autism have self-harmed at some point in their lives. People with autism can find it really hard to recognize, manage, and express emotions, which can lead them to really understandably feeling frustrated, anxious, and misunderstood. I think is one of the things that I've heard the most from people who are neurodiverse, is that idea, that people really are not understanding them. And things that a neurotypical person might not find stressful or overwhelming can be really extremely overwhelming for people who are neurodivergent. So, for example, changing of plans, particular environment, noises, and external stimulus can really have an impact on somebody. It's believed that people with ADHD also have higher levels of self-harm, especially in that relation to the impulse control, which I mentioned, and difficulty regulating emotions. And it's currently identified that more females are likely to self-harm than men. But like I say, I think, again, it's really important to not make assumptions, because what we know is men do also self-harm. And it doesn't mean that people with autism and ADHD self-harm and that they all do that, and we should never make assumptions. Many people who are neurodiverse have found it really helpful and found other ways of managing and been supported to find other ways of managing emotions. And interventions around kind of other ways of coping can be really just as helpful. Research is still very lacking in this area. When I was researching to do this training, I really struggled actually to find much research at all, which I found really interesting. Just really want to think about what we mean when we're talking about distress, because I think it's a word that I tend to use more than mental health difficulties or mental health issues. Because I think distress is like, it really encompasses all of those things. And when we're talking about distress, what we're really talking about is emotional pain, that internal pain, things like overwhelming feelings or emotions, however we term it, at its heart, it's overwhelming emotional and psychological pain. We don't get born knowing how to navigate emotions, knowing how to deal with distress, and knowing how to regulate our emotions. These are things that we learn. And I think sometimes we can be, there can be narratives, unhelpful narratives around, oh, people, oh, well, they just don't know how to manage emotions, or people don't know how to manage feelings. But actually, it's not a failing in them, it's that they've never been shown how to do it. Um, and therefore we can't expect people to just know how to regulate themselves in helpful ways. It's not a failing or a weakness in individuals who struggle with it. It's because many of us have never been shown. And we wouldn't think, it's really interesting, we often kind of maybe do it in mental health, but we wouldn't think someone who was failing if they didn't know how to do other things in life, if they've never been shown. For example, if you're a bus driver, and you've recently left your job and you go into teaching, but you've never been taught how to be a teacher. We wouldn't then blame them for not knowing how to be a teacher. That's ridiculous because they haven't been taught how to do it. And it's exactly the same for people who struggle to manage emotions. At school, we're not taught about how our brains work, and what it is to navigate being human. What does that even mean? And what are all these things that are going on inside of us? Therefore, people struggling, especially with self-harm, need to be supported to learn about emotions, maybe if that's not something that they've experienced in the past, and to understand and find ways of understanding and coping in ways that are not harmful to them. So again, it's not about judging them, but about thinking about alternatives that won't cause them harm. So the statistics again was quite lacking, I think, in this area. But I think it's really hard because the prevalence of self-harm, and what we know about it is impacted by underreporting. So there is a general agreement that it is underreported, and people generally don't tell people when they've self-harmed. So it's really difficult to get a clear understanding as to rates. But what we do know, and what some of the data suggests, especially within the UK, is that 60% of adults, and 90% of young people aged between 12 and 17 do not contact medical or psychological services after self-harming. So they will either manage it themselves or they don't share it with other people. And that can be for a number of different reasons, which we cover as we go on. But I think shame is definitely one of the biggest. That fear of judgment as well. I mean, it's also not uncommon for people to identify what they're doing as self-harm. So I've worked with a number of people who didn't class what they were doing as self-harm. For example, a person who was banging their head to stop their thoughts. They didn't think, oh, that's self-harm. It was just something they were doing in order to try and stop the thoughts that were going on in their mind. Um, and again, like I said about the person who was getting into fights, they didn't really see that as self-harm, but obviously it was causing harm to self, and they were purposely starting fights in order to get harmed. So that wasn't something that they particularly kind of recognized. Self-harm rates tend to peak between the ages of 16 and 24 for olds in women, and in men it can be around 25 to 34, and that's kind of what NICE are telling us. During COVID research, it was suggested that 1 in 4 young women and 1 in 10 men have self-harmed in their lifetime, which is quite a lot. The rate of self-harming younger people continues to increase, and this is what we know at the moment. And I think further research is being looked at as to why that might be. Unfortunately, I haven't got the time to go into the reasons why that might be today, because it's such a huge topic. But I think we're living in quite a different world, and quite a challenging one for a lot of people. So I'm not really surprised to hear that it's actually getting harder and people are less connected, and social media. I think there are a lot of probably things that are kind of in relation to that. And some research suggests that there is a link between people that are highly self-critical, so really critical of themselves, have talk about themselves in a very critical and very negative way. They can be more likely to self-harm. There is definitely a kind of relationship there, that has been seen in research. So how we talk about self-harm really matters. I think the way in which self-harm can be spoken about can have a huge impact on individuals, but also it can kind of create some unhelpful assumptions as well. So when discussing or recording information that the person is going to receive, avoid like letters or things like that. Avoid using words as the harm was superficial, or just using the word superficial. I think it's really common language within the healthcare system because what it's referring to is it's indicating that the wound or injury that was caused didn't need any medical attention or hasn't caused severe or permanent damage. So it kind of makes sense within the sort of the medical realm. But if you're an individual and you hear that, it can feel very different. You can read that in a very different way. And I have to say, I don't think it's sort of really ever explained to the person why it's called superficial. And so to that person who's self-harmed, hearing or seeing that written about their self-harm can understandably lead them to them feeling dismissed or feeling that professionals don't think what they're doing is serious or genuine. And as you can imagine, that could lead to someone then feeling a lot worse about themselves and feel that services are not caring. So I think that's something just to be mindful of, and I have come across it quite a few times on letters to GPs and things like that, and that's been included. And I think it's been really upsetting for people. I think another common way that people are often spoken about who self-harm are people who self-harm must have emotionally unstable personality disorder, some form of personality disorder. So people who receive a diagnosis of personality disorder are often associated with self-harm because again, it's about regulating emotions and that's often a way that they try and find a way of regulating how they're feeling and managing that extreme experience of emotions. However, not everyone who self-harms will have this as a diagnosis and or should have it either. So it's about not kind of, again, making assumptions about people just because they're self-harming, they must have a personality disorder. And I am planning on doing a bite size in the new year around kind of personality disorders, where that's come from, how that's diagnosed, what that looks like, and alternative ways of thinking about it as well. We also might hear that people who self-harm are attention seeking. And again, I think that can be a very common narrative. I think often not meaning to be harmful or hurtful about people, but I think also it can indicate how we're feeling about working with somebody who's self-harming repeatedly, because we might feel a bit flustered or frustrated or feel like we're not skilled enough to support somebody. Um, and I have to say, people who self-harm, I would say generally are never doing it for attention. The majority of the research and also my professional experience of working with people points to self-harm as a way of managing distress and overwhelming feelings. And many will not share that they've self-harmed. People very rarely solely use self-harm to try and get their needs met or as a way of communicating that they're distressed to others. It's often not an intention, especially a conscious intention of somebody. So I think really trying to let go of that idea that it's attention seeking and maybe thinking again around, is it a form of communication or is it actually a form of then just trying to manage the best they can with what they've got? And that importance, again, I know, and I've probably repeated this so many times throughout the training, is about not making assumptions. And I think the reason why I talk about assumptions a lot is because we're human. We all can make assumptions. And again, we're not trying to be nasty or unfair to people, but I think as human beings, this is what we do to try and make sense of what we might be seeing and who we might be working with. And I think one of the most common assumptions that are made is that people that self-harm are suicidal. And this is where I was talking about earlier on about how it's often very much lumped together as one thing. Suicide and self-harm, suicide and self-harm. It's often talked about within the same kind of sentence, the same breath, within the same training. And I think it's really important to not make that assumption either way. So self-harm and suicide, I think are very different. People who self-harm often speak about it's a way of coping, helping them to actually stay alive. Not because they want to die. Actually, it's how they manage to stay in the world. And many people have actually said they've not had thoughts about suicide when I've worked with them and they're using self-harm. Um, but it is also important to ask that if they are having thoughts of suicide, you might say something like, "Oh, thank you for sharing with me that you self-harm as a way of coping." And what we know is that sometimes people who self-harm can also at times experience thoughts of suicide. Is that something you've ever experienced or are experiencing? And again, you're showing you're not making assumptions by asking, is this something that you relate to in any way? Research suggests, it does suggest that people who self-harm can be more at risk of dying by suicide, but not because of the self-harm, but due to the underlying reason of the distress that they're experiencing. So I think that's really, really important to kind of hold on to. So they're not more at risk because they self-harm, but they're more at risk due to the underlying reason. And if that kind of reason continues. So I think those things to just be curious about and just be mindful of are really helpful. Something else also that I've come across before, and again, I don't think it was intentional, kind of dismissive, but if the injury isn't that bad, then there's nothing to worry about. It's really not about the injury. It's not about the harm that it caused. It's about the pain behind it. I think it's really easy to sometimes miss the suffering that the person is likely experiencing, regardless of the severity of the wound or the method of self-harm. I think we still need to show up with that concern and care and be curious as to what might be happening for them and what they might need. I can remember at school, it wasn't uncommon for people in kind of back in the day to use things like compasses and things as self-harm with. And actually, I think it was readily kind of dismissed as a bit of a trend. But actually, the friends that I know that did used to do that, there were other things that were going on underneath. But obviously, that was then missed because it wasn't seen as something that was that harmful and wasn't creating kind of wounds to worry about. Well, what we know or what can be sometimes helpful to share with people is the risks around self-harming. So, and I'm going to say these risks are really often unintentional consequences of self-harm. So I use that unintentional consequences because people are often not thinking about a long-term impact or damage that what they're doing might cause. It's rarely intentional. So the long-term consequences or consequences of the self-harm, it's very rarely intended in people and kind of the issues that can come up. So for example, acute liver failure from paracetamol overdose or overuse. So in the UK in 2005 to 2007, they found that 28% of the liver transplants were for acute liver failure caused by paracetamol poisoning. And when I used to work out on a children's ward quite a few years ago now, we used to get young people coming in who had used paracetamol to overdose. But actually, again, a lot of the time they were saying they just wanted the pain to stop, which again would make sense. It's called a painkiller. But they didn't realise actually that there were consequences to using the more paracetamol than we should. So I think, it's really important to hold in mind that people are often completely unaware of that risk and how it might damage organs. Permanent scarring to skin and damage to tendons and nerves. Again, I would say a lot of the people that I've worked with where they have used various methods of self-harming didn't intend for the damage to be permanent or to damage nerves or tendons. It was again about using it to try and manage how they were feeling. Infections to wounds such as sepsis, I think, is really important to think about. I think people don't often think about how that can be a risk. And again, people who are self-harming are not going to be maybe thinking about those things and thinking about how they could best do it safely. Organ damage from poisoning from other kind of drugs or alcohol or other things that people might use. So I have heard of people swallowing chemicals. Um, Addiction, so it can be obviously a long-term impact, especially in terms of like if they're trying to regulate their emotions and they're trying to use painkillers in a certain way. Overuse of that can then numb how they're feeling. So they tend to use it more and more and more. And then before we know it, we have an addiction. They didn't do it with the intent to have an addiction or to cause addiction, but that is an unintentional consequence. Elevated risk of suicide. And that might not even be to sort of like die by suicide. It might be due to the fact that the self-harm, they've unintentionally caused themselves that much injury that they've died. But again, it's about the ongoing distress really that people might be experiencing. So if they've been self-harming for many years and this distress that they're experiencing continues or gets worse, then obviously they can then understandably become suicidal. Often people talk about interventions like therapy and trauma stabilization can really help people find alternative ways to managing and making sense of that distress in the hope that harm's no longer needed. As I've mentioned, also accidental death, but I think shame is a massive, massive unintentional consequence. So if you're thinking about you've got these high emotions in the moment, you just want to alleviate it, you will find any which way in which to do that. And you either hit a wall, you break your hand or your fingers, um, you cut yourself, and then afterwards, yes, you've got that relief, but afterwards, for many people, they will experience increased levels of shame. And it can become a bit of a cycle then. Self-harm. Oh God, I feel awful about myself. I've just done that. I now feel this awful shame. That intense feeling of shame then leads to that want to self-harm again. So it can become a bit of a cycle for people because that feeling can be so intense. So self-harming safely. So this can feel a little bit controversial for some people, but I think one of the most important things that we can do is prevent harm to people. But by asking or telling someone to stop self-harming, will not keep them safe. It's not for us to tell somebody that they must not self-harm just because we have an idea about it being unsafe. That isn't a good enough reason for someone to stop. If they could just stop, they would stop and they wouldn't be doing it in the first place. So it's serving as a coping tool. What they need is a number of alternative ways of coping before they are going to be able to be able to stop or even think about stopping. If you think about the number of things that we do on a regular basis that we know are not good for us. So I know I do it. I will admit I'm a smoker. I know it's not good for me, but I still do it. And somebody telling me to stop isn't just going to enable me to just stop. So it can sound counterintuitive, but I think supporting someone to think about how they self-harm safely is important in terms of that reduction to harm to themselves and those consequences that we were talking about in the previous slides, those long-term potential risks. Um, Things like infection and permanent damage, I think we can really support people to think about that. So a safe and sterile self-harm kit can be really helpful to think about with them in reducing harm or those unintentional consequences such as infection. Um, so I work with a young person who used to cut themselves, and they would use anything available to do this. It wasn't unusual for them to do it using broken glass or nails and blades that weren't clean. They would rarely care for the site of the wounds following self-harm, as they didn't want people to know, they didn't want to draw attention to it, but also, again, because of shame, it was just like, right, just ignore it, pretend I haven't done it, pretend it hasn't happened. So we talked about how in the short term, while we were working together, about having her to sort of like pulling together and having a kit with a clean and sterile tool in it that they could use and know it was there, with antiseptic wipes, that it was clean, the tool was clean, the area was clean, and that there were plasters and bandages if needed afterwards. They agreed to do this, and they put a little kit together and they had it in this place where they knew they could access it. They even had one that they would occasionally take out with them when they were worried that they might be in a situation where that impulse to self-harm would be there. And they felt that actually just knowing it was there over time was enough to help reduce self-harming. Just knowing it was an option for them was enough, and knowing that they had this kit that they could access. And also, once they found alternatives, and we did some work around sort of breathing exercises and other ways of managing really impactful emotions, that they no longer felt like they needed it anymore. So they just ended up giving it up and not using it. So I think if we can help someone to think about their safety, it's a huge factor in reducing that harm. And like with anything that we're doing, we're trying to keep the person at the heart. There isn't a one size fits all. I wish there was, because it would make it so much easier for us to know how to support people. There are some things that some people will find really, really helpful, and things that others won't, just like the rest of us. There are some things we like, some things we don't like. We're all very different. Checking in with them about what has been suggested in the past, and what was helpful and what was unhelpful, can be really, really helpful in you then having a better understanding and a better sense of what maybe the person needs. So if we're repeating things that people have told them in the past that they found unhelpful, they're just going to switch off, aren't they, and probably not come back to us for support. I think it can just be so helpful in thinking about what other things might be helpful for you, what things haven't helped and what has helped, I think are really key. And the things that can really help. So if someone shares with you that they self-harmed or they plan to, I think honestly thanking them for sharing it with you, I think is really important, and acknowledging that it might have felt hard for them to share that with you. I think, that really validates that it can feel difficult to talk about. Finding out why it is they shared this with you, I think, is really key in what we might do next. Is it because they want you to just listen? Are they sharing with you as this is something they would like help with? Find your own way of asking that question, so you can feel more confident to have that conversation. There's no set way of saying it. So I normally say something along the lines of, like, I really appreciate you sharing with me that you self-harm, or their language, whatever they've used. I know it can feel hard to talk about. How do you need me to show up for you right now? Do you want me to just listen, or are you wanting some support and advice around this? Or simply asking, what is it you need? having a conversation, that they're having thoughts or an understanding of why they're self-harming is just so helpful and really valuable. And speaking with someone about the feeling more and focusing more about the feeling that they were experiencing rather than what they did to themselves. So what they did to themselves is the end result, but actually what we really want to understand is what that feeling was. Thinking with them about naming those feelings. I think and naming feelings that come up for them in different situations might really help them to identify what leads them to self-harm. And what I know from working with lots of different people in the past is sometimes they've really struggled to even name feelings and emotions. So I think, even something like the emotion wheel that I've got up on the screen can be really helpful in supporting people in just starting to think about emotions and trying to find out and support them to think about what things might kind of lead them to doing that. Think about with them about what other ways that they've used to try and deal with similar feelings that wasn't self-harming. So times maybe where they couldn't do that, how did they manage that? Other things that they might do. Are they able to think of any early warning signs, anything that particularly leads them to self-harm as a release to the overwhelming and distressing feelings? Do they notice experiencing relief from starting to plan to self-harm? So like I said, a bit like with the person I was working with, just knowing they had the kit there was enough a lot of the time for them to not self-harm because they knew it was there. They knew it was available to them if they really needed it. So I worked with an individual who had a difficult childhood when something happened relationally within our family. Uh, and that would be the thing that would tend to lead them to self-harm. So arguments within the family, kind of parents sort of criticizing and things like that. Out of all of the things that were going on at school and things like that, that for them, it was the key was around, it was to do with family relationships that would often invoke those overwhelming feelings. So then we were able to do some thinking about that and doing a bit of problem solving, a way of distancing. So they weren't around when arguments were happening and things like that, and things that they could do to manage, like listening to music. And those were really helpful. Just being curious. So how long does the relief last when you self-harm? And can they tell you, and can they tell that they have to self-harm? So do they get that kind of feeling of, so some people talk about it as an impulse or a kind of a need, like if they don't do it, they can't settle. And like this feeling like they're being driven, helping them to sort of like maybe think about that can be helpful again in kind of identifying what might be leading to those feelings. Are there any ever kind of unhelpful or unintended consequences to the self-harm? So feelings of shame, infections or pain, anything that's happened in the past. Explaining that although it might be helping with them in the short-term relief, but it will not be helping in that long term to heal from the distress that they're experiencing, and finding ways of feeling safe in the long term, because obviously we're kind of impacting the body. And I think it can be really helpful to just to 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 kind of name that. So practical ideas, what might help? So there are things with people that I've worked with in the past that have found helpful. And again, I also work with people where some of these things weren't helpful. So again, it's that idea of just checking out somebody. So an elastic band around the wrist that you can ping when you've got an impulse or that feeling that real need to self-harm, because it can kind of really sting. You have to be careful, obviously, with that person that it's not too tight, because we don't want to cut off circulation. But an elastic band ping around a wrist can be really helpful for people. Ice cubes, especially inside the knee or the back of or the inside of your elbow or the back of your knee, can produce a really impactful effect of pain. and might help somebody who wants to self-harm, who finds it helpful in some way to feel that kind of intensity of something else. So the ice cubes in those areas can be really, really helpful. Submerging your face in cold water can be really helpful. Cold water swimming, tip, which I will talk to in a minute, and distraction as well can be really helpful. So distraction, it is again is great in the short term, great short term tool. It can be used in times of increased emotions of distress, and the whole idea of distraction is to focus on those times when it's really, when it's really powerful emotions and distress. Uh, and it might be enough to just support someone in that short term to not self-harm. The reason why we talk about distraction is only helpful in the short term is because it's not dealing with the underlying issues of where the pain is coming from, what the emotional pain or the overwhelming emotions. So it's about supporting them in that moment where they're feeling overwhelmed, and it won't help really in the long term because nothing's going to resolve. The distraction can be anything that works for the individual with self-harm. It will likely be helpful to do something that involves physically doing something, even with your hands. Like I know somebody who found it really helpful to hit a pillow. And again, because that was safe, but it was that they were able to get out a lot of their feelings that they were feeling by doing that. Or if you think about punch bags and things. Playing a game on the phone, again, using the hands or using the whole body, like going for a really brisk walk. And I say a brisk walk, not a stroll, because again, it will help expel some of that energy and some of those emotions that somebody might be feeling. And then once calmer, maybe listening to some music or watching a film might help. Encourage the person to positively mark the fact and at times when they did not self-harm by doing something nice for themselves. I think it is really important to really mark it and celebrate with them. And they could be really, really like creative and inventive with whoever it is that you're working with, as depending on what might be helpful. Another person I work with found it helpful to scream into a pillow. So again, it's just thinking about what works for that individual. So tip, this comes from a particular therapy called dialectical behavioral therapy. I've included a video in the resources which you can share and also watch yourselves with that share with others. And it tells you I've also included one about muscle relaxation as well, which can be really good. So tip is helpful as it changes the physiology of what is going on in the body when we're feeling overwhelmed by tense emotions. So it helps to rest the nervous system and helps us to come back to the here and now. This supports that ability to then change up how we're feeling in the short term, which in turn can reduce that impulse again and that feeling of wanting or needing to self-harm. Again, the same with distraction. It's a short-term tool. It's not going to help in the long term because it's not looking at the underlying reason as to why somebody might be experiencing those intense emotions. But it can really, really support. And I would say anything to do with cold water, I think we need to be, or temperature change, we need to be really mindful, which is the first one on tip, and the same on the other slide when I was talking about submerging your face. People with heart conditions need to be really very careful about this. So it's recommended that they skip this first step. But then we have that temperature, so splashing cold water, holding ice, or cooling down your body, or it might mean that you need to warm your body up. It depends on the individual. Intense exercise, so jump, run. It recommends 20 minutes, but there's also evidence to suggest that even a short burst of intense exercise can be really beneficial. Paced breathing, so inhaling for 4, exhaling for 6, is it's slowing down the breathing and making it steady into a rhythm, which can then soothe that our kind of our threat system. Also paired muscle relaxation, so tensing each muscle group, so like clenching both hands and releasing while breathing out. And like I say, those the videos and the resources will give you opportunities to read what those might look like. Oh, and as with everything that we do, remember that you need to look after yourself. And this isn't just an add-on. I know it feels like an add-on, but I've been limited for time. But you are really important. So looking after yourself, remembering that you need to put your own oxygen mask on first. You need to look after yourself and think about what your needs are and what support you might need. And that reconnecting with people, connecting with friends, family, colleagues, and remembering that you're just human and this type of work can be impactful, and that is really understandable. And don't underestimate the impact that it can have on working with people that are distressed. And it can be really hard witnessing or hearing about how somebody is hurting themselves. So please always seek support and look after yourselves. And there are I think three slides of resources which I will send out to you all after today. And they should also be hopefully available on the website in January. But there's lots of different kind of resources on there. Guidance for professionals around adult self-harm. Some NHS trusts have developed some really good toolkits that are readily accessible and easy to download. Information for individuals that we can give out to those that are self-harming. And I've just included some videos as well, like I said, around some of the techniques. I've included the emotions wheel, so you can access that as well if you wanted to have a look. And NHS where to get help as well for self-harm, because I am aware it can be very tricky for people to access support who are maybe self-harming due to the fact that I know a lot of our IAP service or the early intervention services don't generally work with people who are self-harming. So it can feel hard to sometimes get support, but there is support out there available. And that's the end. So I'll stop sharing my screen. And sorry, that was so obviously quick and a very much a whistle-stop tour. Lots to cover.